Thank you, members. It's the appointed time and we have a quorum. Please invite the administration to come in to join us. Members, please refer to the papers issued since the last meeting. They have been given to you on the 8th of May. There is a list of follow-up actions arising from the discussion at the meeting on the 23rd of April 2018. It includes a paper from Dr. Pierre CHAN and other relevant papers. I now ask Deputy Secretary for Food and Health Bureau, Mr. Fong Lai, to take us through the response paper. Thank you, and I thank members for the questions raised. We use this paper to reply to members' questions in relation to Clause 70. These are technical issues. We have sought advice from the Department of Justice, and we have set our responses out in the paper. And in relation to Dr. Pierre Chan's letter, we have also given a response paper. We have explained our approach in relation to our quorum. Dr. Pierre CHAN also asked about operational details of the clauses. We have given a detailed reply. If members have questions or if they would like further elaboration, we will be happy to give them. Dr. Pierre CHAN, thank you. I asked those questions for my fellow practitioners, and I would like to ask further questions in relation to the reply paper you gave. Say, for example, this bill is passed in 2018, this year. You say that it will take some time, say, for example, till 2020 or 2021 before you start registration work of clinics. Is that right? When the bill comes into effect, there will be a grace period. Well, I call it a window period. It will take some time for all clinics to be registered. So I would like to ask about that window period. Roughly, how much time it will take for the thousands of clinics to complete the exemption or the license? If someone says that, they would like to open a clinic and would like to make an application for the exemption, would you be able to immediately help them, or you will only start with hospitals first before you deal with other practices? Well, there is the CAP 343, the Medical Clinics Ordinance. There will be another piece of legislation to replace it. So during the window period, when not all clinics are registered, do they have to follow the old ordinance or the new ordinance? That is in relation to your inspection work and law enforcement as well as prosecution. Dr. Chan has asked a number of questions. Well, he has asked a lot of questions before that. These are questions relating to actual operations. I will ask Mr. Fong to answer those questions. You can perhaps explain further to Dr. Chan after the meeting, and if there are questions, you can come back to us. Mr. Fong. Thank you. I understand members' concern in relation to the timetable. Well, we have taken the risk-based approach. When the bill comes into effect, first year we will deal with private hospitals. After that, we will use the next year for day procedure centers. There are about 500 of them or so before we move on to clinics. There was a question asked. Before we started dealing with clinics, and if a doctor wants to open one, what should he do? Well, currently, there is no need for the clinic to apply for a specific license to operate. It's until when the provisions relating to clinics come into effect that a license is required. Of course, doctors are most welcome to follow our new practice. And if it is an exempted clinic, it will be dealt with accordingly. As to how much time we'll need, it depends on the actual situation and the actual number of applications for exemptions, and how many clinics will come to us to apply for a license. We have to make sure that the majority of them are ready before we have the penalty provisions come into effect. But at least you will have the numbers. Well, all clinics will make an application. It's only a matter of whether it's for a license or for an exemption. So you have the figures. You don't have to wait to find out the number of clinics that will make the application, because we both have the figures. You say that, well, I do agree. Before those provisions come into effect, that is one case. I don't know when they will come into effect. You talk about the actual time will depend on the number of figures. I can tell you that we have the figures. So can you elaborate on your answer, please? Indeed, we have conducted a survey. We know that there are about 5,000 such clinics, and 1,500 of them will need to apply for a license. The remaining ones will apply for an exemption. From the time when we conducted the survey till the provisions come into effect, there will be about 3-4 years, so we don't know what will happen then. We can't say for sure what will happen. Well, even for this year, the figure may be different. That depends on the actual situation. However, the bottom line is that when most of these clinics are ready, we will then enforce those provisions. Dr. Kokaki, I would like to get some more information from the Deputy Secretary. You talk about practices that are providing services. Say, for example, those that provide chemotherapy, eye surgeries. They provide treatment and help to patients. If timing is wrong, then the services will have to be suspended to wait for a license to be granted. Patients will be affected directly because, as you know, that hospitals can't provide those services. So, say, for example, for endoscopy, day surgeries, eye day surgeries, and chemotherapy, if they are all halted, then there will be trouble. How long is that window period? Have you set aside sufficient time for clinics to rectify the situation if they don't meet all the requirements? If you're not fully prepared, then there will be chaos. I would like to get some clear answers from you. Yes, thank you. And thank Dr. Kwok for the question. That is also of concern to us. So we have designed a provisional license. When day procedure centers come to make applications, and if they can't meet all the requirements, the Department of Health may consider issuing a provisional license for the continued operation of these centers. In the meantime, these centers will have to make improvements. When they meet all the requirements, a proper license will be given to them. We have to ensure that there is sufficient transitional period for them. You say they may. That means they may not grant the provisional license. How long is that transition period? It is very important. It's not just a matter of giving them 6 months or a year. Say, for example, ventilation. If in that commercial building there is no ventilation facilities, the whole clinic will have to be moved. If you impose a high requirement on ventilation, well then most of the operations in commercial buildings won't be able to meet that requirement because they use a central air conditioning. So these are structural problems that are beyond the control of the clinics themselves. I don't know if you understand the difficulties that they face.
Well, during the consultation period, we heard comments like this. The DH will respond to this. I defer to Dr. Chiu. Dr. Chiu, thank you. The Deputy Secretary mentioned the design. In fact, for the day procedure centers and clinics that are in operation, we have made it clear that during the transitional period, perhaps we can work out a date for those that are in operation. They have to fulfill the minimum requirement. They have to have an applicant. They have to have a executive medical executive, chief medical executive, and for those that are in operation, we would issue them with a provisional license, and then we'll work out whether they are able to measure up to the requirements, and they can continue with the operation in the interim period. In part 9, we're going to have the transitional period. Perhaps we carry on with our scrutiny. Clause 78. Mr. Lee, Chairman. Part 6, Division 2, Clause 78 refers to the appointment of case panels. There are provisions regarding the appointment of the case panel. Legal advisor, please. Members. Next, please. Clause 79 refers to the case panel having to consider the complaint and whether the complaint is substantiated, and recommendations will be made to the complaints committee. That's Clause 79. No comments? Next, please. Division 3 contain 80 and 81. That's about the confidentiality of information and protection of members of the complaints committee. Clause 80 provides that for certain information or documents obtained for the purpose of considering the complaint, a member or secretary must not disclose or give the information to another person, and any breach of these constitutes an offense. Legal advisor, please. Chairman, thank you. Clause 80, I'd like to hear from the administration an explanation. In the first paragraph, it refers to any information or document obtained for the purpose of considering a facility complaint. It doesn't mention whether this is confidential information. It seems that the way it is couched is rather broad. So what is the legislative intent here? The information covers a broad range, and for the information to be disclosed or given to another person, and there is no definition for another person here. Does it include the other members of the complaints committee as well? Mr. Lee? Thank you, if I may. Thanks very much, legal advisor. Clause 2 has highlighted certain situations in which the information or documents can be made available to another person. I think the disclosure of the information to another member doesn't constitute any problem. And 4B says that if the person did not know and had no reasonable cause to believe that the information or document disclosed or given was confidential, if the confidential is not stamped confidential and people don't have any reasonable cause to believe that it is confidential, then this clause doesn't bind it, and there is a defense clause as well. Legal advisor. 81. A member or the secretary must not disclose or give to another person any information or document obtained. Mr. Lee, can you elaborate on this? This is a good comment, but the way it is drafted can cover what we intend to cover. All right, let's move on to the next one. Chairman, thank you. Clause 81 refers to the protection of members of complaints committee, and there is the legal protection there. Legal advisor, please. Members? No? Next, please. Chairman, thank you. Part 6, Division 4 contains clauses 82 to 87. It refers to the specific procedural matters regarding complaints. 82 provides that the complaints can be made to the complaints division regarding a licensed private healthcare facility, and that's clause 82. Members? Legal advisor? Chairman, thank you. Clause 82, para 2. The facility complaint must be made in a form and way specified by the director. What sort of form and what is the way specified by the director for complaints to be lodged? Can these be made known to the members of the public? Dr. Chiu? Chairman, there will be specific forms, and we do have the complaints mechanism whereby forms would be available, and the information will be posted on the web for the members of the public to be made aware of the complaint mechanism. And we're talking about the licensed facilities. What about those that are exempted? Chairman, those that are exempted are not licensed facilities, and they cannot be complained. Well, they are not within the context of this provision. Mr. Fong, it doesn't mean to say that the DH will not entertain these kind of complaints, although this doesn't fall within the context of these complaints committee. Any further questions? If not, 83. Chairman. Clause 83 refers to the preliminary processing panel and all the procedures there. The PPP will need to submit a report to the complaints committee after handling all the matters. Any questions? If not, next, please. 84 provides that after receiving a report from the preliminary panel, a case panel will be appointed. But if a complaint has been withdrawn, or if the complaint falls into certain categories, then it would be an exception. Any questions? Legal advisor, please. Chairman, Clause 84, 2E. If the complaint relates to a commercial matter, then the complaints committee will not consider these. Can you be more specific about the kind of commercial matter that you have in mind? Commercial matter, Dr. Chiu, Chairman. In our code of practice, we would specify the transparency. Now, for the medical fees and so on, these are something between the two parties. This is something in the contract between the two parties, and the complaints committee will not handle these kind of issue. I noticed that 2C refers to anonymous complaints. Sometimes emails can be anonymous, and there is a specific person, but it doesn't contain any specific name. It is anonymous. How would you handle emails like this, Mr. Lee? In clause 82, we have specified the kind of people who can lodge a complaint, and they include the patient of the facility or the personal representative of the patient. If he's deceased, we would verify the status before we would accept the complaint. If it is anonymous and we cannot ascertain the identity, then it would be hard for the complaints committee to carry on with the complaints processing. Nothing else? Next, please. Chairman. Clause 85 provides that a case panel, if there are issues in dispute, then the case panel can recommend that alternative dispute resolution be used to handle the complaints. Any questions? Legal advisor. No. Next, please. Clause 86 provides that a case panel, after considering the facility complaint, make one or more of the recommendations for the complaints committee's consideration. Members? Not. And next, please. Chairman. Clause 87 provides that the complaints committee can take the following actions. The complaints committee can close the complaint case and inform the complainant in writing of the decision and any action taken or to be taken in relation to the private healthcare facility. Any questions? Next, please. Chairman, Division 5 contains 88 to 91. Clause 88 provides that the complaints committee, the preliminary processing panel or case panel, can demand information or documents be provided. Any questions? Right. Making available information, if he chooses not to make available the information or documents, what will be the liability? Chairman, thank you. Division 5 is about the power conferred upon the complaints committee in conducting investigation. Unless otherwise specified, and there is no penalty, of course, the refusal to submit the information would be considered or can be considered when considering whether the case is substantiated. Any refusal to submit documents can be a reason for the case panel or the complaints committee to decide whether the case is substantiated or not. Any questions? No? Next, please. Chairman, thank you. Clause 89 provides that the case panel or the complaints committee can conduct interviews with anybody regarding a complaint. Any questions? Not next, please. Chairman. Clause 90 provides that the interviews with the complainant should be recorded. Thank you.
I would like to ask, in relation to the interviews, is it like a police interview that the person will have to be cautioned before questions were asked? Before questions are asked? Well, this is not a statutory procedure. So it's not a must that one has to be cautioned or to be accompanied by a lawyer. These rules don't apply because the nature of the interview is to obtain more information in relation to the case by the complaints committee or the case panel. Any questions? If not, next. Thank you. Clause 91 stipulates that the complaints committee or the case panel may, when considering a facility complaint, obtain an opinion related to the matter by a regulatory authority, medical professional, or another expert. Any other questions? If not, next. Thank you. Part 7 runs from 92 to 97. There are 2 divisions setting out the miscellaneous offences and relevant provisions. Division 1 comprises 92 and 93. 92 says that except with prior approval in writing of the director or except as provided or permitted by any other law, no premises may bear a title or description, otherwise it will be an offence. That is Clause 92. Any questions? Legal advisor. Thank you. Clause 92. It states that except with the prior approval in writing of the director, person involved may not use these title or descriptions. In relation to the legislative intent, when can the director approve the use of a title or description? In relation to what matter? I think this is just to build in some flexibilities. We mean to say that, well, for a premise, it should not include an expression specified in Schedule 7 or similar expressions, or expressions that suggest that the services provided are medical services provided in a private healthcare facility. So the intent is that unless you're an authorized institution, you may not use descriptions such as healthcare, so in order to avoid misleading the public or consumers. So if you use such an expression, it will be a permitted facility, whether it is a licensed one or an exempted one. But we would like to keep some flexibility. So if the director is satisfied that the use of the titles or descriptions is accepted, then an approval will be given. In other words, that means the director doesn't think that the use of such expressions or titles will not seriously mislead the public. Legal advisor, I have a question about drafting. In the Chinese version, bracket 1A and B, in between A and B, there is no corresponding term, and. The English word "and" is missing in the Chinese version. There is no connective. (92) 1A and B. I'll give a brief reply. Thank you for the question. In the Chinese version, subclause A, it says that we'll have to fit these descriptions. I think it will carry the same meaning, but we will go back and consider whether to add the word cup, meaning and. Legal advisor. Our view is that, well, from the flow of these two subclauses, you need the connective and to express a clearer meaning. That means the use of an expression or similar expression, and the title or expression suggests the services provided are those provided in a private healthcare facility. So it would be better to put the word and in its Chinese equivalent between those two. Any questions? If not, next. Clause 93 stipulates that if a person makes a statement or representation in an application, it is an offense. Does it mean that people can easily, inadvertently break the law? Say, for example, if someone says treatment, therapy, well, then would they be caught? The scope of these words may be quite wide, and one may be inadvertently break the law. Let me try to explain. I think you're asking about Clause 9, the prohibition of the use of titles or descriptions. In Schedule 7, you'll find out, well, the word terms are set out. Say, for example, if it is treatment, then it will have to be a licensed or exempted facility. So if you use such terms, that means there is an element of treatment in the service. We don't want to mislead patients or consumers. So unless you have an approval, you can't use such terms. If you have a license or if you have the exemption, then you may use these terms stating that it is a treatment center. Apart from these titles or descriptions, well, there is also another requirement. That means these terms suggest that the services are provided in a private healthcare facility. Say, for example, the term treatment is used, but it is not referring to treatment of a person, but the treatment of, say, a computer. Then it is not an offense under Clause 92. We have narrowed the scope of the offense in that it will have to apply to, say, for example, treatment of a person. If someone in a facility conducts the work that a doctor would do, there are a lot of facilities, say, for example, they call themselves health centers. It may not be Western medicine, but traditional Chinese medicine. Would they be caught? Will you look into what the nature of the services provide, or just the name? I think it depends on the actual case. We don't want unlicensed facility or facilities without an exemption to use certain titles or descriptions to give the impression that the facility is approved by the government. If you use a surgery, operations, or dental services, then you will have to be licensed or exempted. But if you use terms in a gray area, I think we'll have to look at each and every case to see if someone will get the impression that the facility provides services provided in a private healthcare facility. Legal advisor. I have some operational details about 92, brackets 2, 3, and 4. Well, if it is a private healthcare facility, then it cannot contain a title or description of others. Say, for example, if it is a day procedure center, it should not contain expressions of, say, hospital. But now we do see names that, say, for example, healthcare center, procedure center affiliated to a hospital. Will they be exempted? We have considered that. Thank you, legal advisor, for your view. I do think there are mainly two categories. First, the operator may be a hospital, say Tonghua groups of hospitals, such and such hospital, or it may be a statutory body. The law permits that name. Well, under clause 92, it says that except with the prior approval permitted or accepted or permitted by another law. Say, for example, Union Hospital. If there is a clinic operating in another location, they come to us for a license, they will give us a name, and then we will consider the case. When the director approves the application, it will be an approval in writing by the director to use that name. I think the general idea is that we don't want consumers to be misled that it is a hospital. If it is a clinic, well, the director will have the discretion to give an approval for it to use the word clinic. I don't know if I answer your question. Say if there is the word hospital, then they need your approval. Even if it is not operating as a clinic, is that right? Yes. When they make an application to us, they need to get an approval of the name they intend to use as well. If there are no questions, next. Thank you. I think we're now in Part 7, Division 2, running from 94 to 97. These are other matters relating to offences. Clause 94 applies to bodies corporate. If they commit an offence, or if they are members of unincorporated bodies and they commit an offence, what will happen? If it is proved that it is done with the consent or connivance of or is attributable to the neglect or omission of a person specified in subsection 2, the person commits the offence. Any questions? Legal advisor? None? Thank you. Next. Clause 95 stipulates that in any proceeding for an offence under this ordinance, the person charged is entitled to these defences. Say, for example, that the commission of the offence was due to a cause beyond the person's control or despite all due diligence made by the person involved. Any questions? If not, let's go to the next one. Clause 96 states that the director may compound any compoundable offence. That is clause 96. Legal advisor. 96 bracket 4b says that Any offence under this ordinance or the regulations that is specify the Secretary as an offence to which this section applies. Does it mean that it is specified by subsidiary legislation or any other way? Thank you. Yes. It will be subsidiary legislation if it is specified by the Secretary as an offence. So the type that you would gazette for or what?
係嘅。
Yes, indeed. It is a subsidiary legislation that will be gazetted for negative vetting. Is it? Legal advisor? Dr. Helena Wong. Compoundable offence. Is it the case that there will not be any custodial sentence? Is merely a fine? What sort of cases would attract a commandable offence? Do you have any policy there, Mr. Lee? Thank you. Thank you, Dr. Wong. 96.4a, we have specified certain offences that are compoundable offences. 11.2, that's about the licensee failing to display a license. 44.3, the exempted operator failed to give notice in writing to the director. 49.5, the failure to appoint a chief medical executive and also notify the director of the change. 47.2, the licensee failing to maintain a committee. 83, the disclosure of information to another person. 1185, the licensee fails to make available information as per the director's instruction. 1194, the disclosure of information to other persons. Now here, these are not custodial sentence offence, and these offences are not serious in nature, and these are more like technical breaches, and it is not our intention to slap a custodial sentence on these offences, and would like to make these compoundable offences. Dr. Wong. The provisions that you mentioned are not severe, and that's why you make them compoundable offences. But would there be any differentiation in terms of severity, and will the fines be of different levels? Mr. Lee? Chairman, as I said, these are lighter offences, and they are more like technical breaches, like the failure to display the license. Maybe they just did it inadvertently. For these technical breaches, it is appropriate for a fine to be imposed, and we don't make any distinction between the different levels of fines, because after all, these are technical breaches, and it is our opinion that they can become compoundable offences. It is up to the director to decide on whether they can be so considered. Dr. Wong, may I? 118. The director can demand information from the licensee. If the licensee refuses to do so, and you are slapping a fine, will this lead to procrastination in making available information that you consider to be important? Dr. Chiu? Chairman, thank you. Well, we are looking at the principles and the operation of these compoundable offences. There are other similar provisions in other pieces of legislation. We will lay down the principles whereby the compoundable offence would apply. We also have regard to other legislation. We consider whether there should be a percentage that should be slapped. We have maximum penalty, and we consider percentage of this. Now, for hospitals, the penalty is higher than clinics and day procedure centers. We will look at these principles before deciding on the fines. Whether a compoundable offence would apply would depend on individual cases. If it is a repeated offence, if they reoffend, then compoundable offence may not apply. Well, this is at the discretion of the director. Dr. Wong? Chairman, thank you. If there are complaints against these PHFs, and the director is demanding information, and there is a refusal to comply, would there be just a fine? The director is asking for information in a complaint situation. Mr. Lee? Thank you, Chairman. Thank you, Dr. Wong. There are two levels here. When it comes to the complaints committee, now we have looked at some provisions whereby the complaints committee can demand certain information. A failure to do so is not an offence, but it would have a bearing on the committee considering whether the case is substantiated or not. If it is substantiated, then there would be regulatory measures to be imposed. When the director is asking for information under Section 118 and the facilities refuse to do so, then it would constitute an offence. So here in 96, the director is conferred on power to impose a compoundable offence, impose a fine for these compoundable offences. And if they refuse to make available the information, it can be an offence. So there is a liability here on two levels. Here, it can be a compoundable offence, or it can be some other sanctions that can be imposed. All right. No further questions? If not, let's move on to the last one in this division. 97, Chairman. Despite Section 26 of the Magistrates' Ordinance, there's 6 months in terms of time frame. A complaint may be made or an information laid in respect of the offence within 12 months after the offence is discovered. So we're extending the time to 12 months instead of 6. So this is an extension of the time frame from 6 months to 12. Dr. Wong? I welcome the extension to 12 months, but is that quite enough? Why not 24 months? What is your consideration? Is it a case of not having sufficient manpower to conduct the investigation, or is it a case of not being able to identify the problems? Dr. Chiu? If I may, Chairman, I think we have to strike a balance here. We've looked at the statutes in Hong Kong. Like Mr. Lee said, under 277, Cap 227, the time limit is 6 months. And within this period of time, we may not have sufficient time and we may not have enough time to handle the case. In other jurisdictions, they have the period. In other pieces of legislation, they have for the period of 12 months, and we've had regard to this. Dr. Wong? Well, that's 12 months after the discovery of the offence. It's not 12 months from the occurrence of the case. Now, the occurrence may go back 10 years. Now, once this has been discovered, the prosecution will be instigated within 12 months. Is that right? Is there any provision regarding the time limit for prosecution after the occurrence of the event? Mr. Lee? Chairman, thank you. Dr. Wong? Dr. Wong's understanding is correct. We are talking about the discovery of the offence. Prosecution will have to be instituted within 12 months. It doesn't say the time period from the occurrence of the offence. Unless you have any further questions, let's move on to the next one. Chairman, Part 8, 98 to 123. There are 3 divisions regarding the administration and the implementation and some miscellaneous issues. 98 to 110 are for Division 1 regarding administration. Clause 98 provides that the director may, in writing, authorize a public officer to exercise any power of the director other than that under Section 105. Questions? Next, please. Clause 99 provides that the director may appoint one or more advisory committees to advise on any matter relating to the regulation of private healthcare facilities, to offer expert advice. That's Clause 99. Dr. Wong? This advisory committee, is it a standing committee or is it an ad hoc committee? Yes, please. It can be both, where we've looked at the private health facilities and also the day procedure centers. We've asked the Academy of Medicine to have a look at the situation. There were some experts looking at this. The bill hasn't been enacted, but we have already looked at this, and the director can appoint such advisory committees. So these are standing committees, aren't they? It is one-off. Once that job is done, it will be over and done with. But under this bill, standing committees can be appointed. Dr. Wong, the bill doesn't say for the advisory committees what sort of people will make up the committee to assist the director. So it's entirely up to you what to do with the committee. Is that right? Mr. Fong? Chairman, when we formulate policies, we may need to set up advisory committees. But here, for the purpose of this bill, we'd like to make it clear and confer the power to the director to set up the committees. Whether there is such a provision, we can invite stakeholders to form a committee to proffer advice to the administration. This has been going on even without this provision. It's just that we're making things sufficiently clear. The complaints committee is mentioned in previous clauses, but here it is of an advisory in nature. Whether this clause exists or not, the committees can still be formed. Any questions. Mr. Xiu, the advisory committees, what is the composition? Will there be any members from the trade? Deputy Secretary, we look at the purpose of the advisory committees. If the committee is about a particular trade and particular stakeholders, they certainly will be roped in. It all depends on the purpose of the committee. So members can rest assured if it involves a particular sector, we'll certainly have stakeholders from that particular sector.
Next, Ms. Wong. Well, the next one will be 100. It may be related to 99. If you set up an advisory committee, members may have to be paid fees and allowances. Is it the case that 82 lakhs? Because we don't know what advisory committees they are, and we don't know about their composition either. However, we still have to pay them. I think it may be a kind of floodgate, because we don't know about these advisory committees and their compositions while we pay them. That's the impression I get. Yes, I understand members' concern. I think this is about obtaining expert advice. In a consultation, we have heard views that sometimes we'll have to approach volunteers to help us. But to recognize the contribution they have made, they are paid fees and allowances to make things easier. And it's only because of this reason that we put this provision in, so that we are able to do it. But of course, it depends on the actual situation. Are there similar arrangements under other ordinances? We have taken reference from other ordinances. We have also followed an established practice to pay fees and allowances determined by the Financial Secretary. It's an established procedure and is adopted by some other committees as well. If there are no further questions, next. Thank you. Clause 101 specified that the Secretary for Food and Health may, by under Schedule 8, specify the category of establishment, and it will be a subsidiary legislation. Subject to negative vetting? Yes. Any questions? Ms. Wong. Schedule 8, Health Services Establishment. There is currently only one category. You think that, well, there will be other categories? What are they? Now it's just premises of education or research. So you imagine that there will be other categories. What can they possibly be? We have to make preparations. There may be new technologies giving rise to new categories. That's why we would like to use this bill to regulate them. That's why we have a schedule. Currently, we are aware of clinical trial centers. There is one in Hong Kong U and another one in CUHK. There is a chance that there will be others, but we can't say what they are. That's why we have this schedule, so that in the future we don't need an overhaul of the ordinance to do it. Clause 102. Director may issue a code of practice to set standards. Most of them are related to healthcare professionalism. Well, the code of practice may be revised following update of, say, for example, guidelines and requirements of the World Health Organization. Any questions? Ms. Wong, I think that code of practice is very important. I'd like to ask, the code, does it have the same legal effect as this bill? Yes. So if clinics or facilities breach the code, there will be criminal sanction, is that right? A breach of the code may affect the renewal of license, but there won't be any fines or any other penalties, is that right? That depends on what is the breach. I will defer to Dr. Chiu. As Mr. Fong said, that we will look at the actual situation where there is a breach of the code. Mostly it has something to do with its license. A revocation or a suspension of the license may be the penalty. And if they fail to comply with its recommendations to improve, the director, that means it's a violation of the director's direction. It may be a criminal offense, but the code is mainly to do with the license. I understand that, but these matters are very important because you're talking about standards, specifications, facilities, quality of care. They are all very important. There may be complaints from the public which will then affect the license issuance. I think these are all related to the quality of care. How come that the breach of the code will only affect his license renewal and not attract a criminal penalty? The requirements under the code may be different and more specific. Say, for example, 118 may require a licensee to produce information. Well, if under the code you're required to produce the information, and if you don't, then it's a breach. It depends on the actual situation. The code will set out in detail all the requirements, whereas in the bill we can't possibly list out all the different breaches. But for a licensee, the most important thing is to continue to hold the license or continue to provide certain services. If need be, we can put in place some provisions relating to fines. I can't hear their argument to support their view. That is, a breach of the code does not attract a criminal liability, because you say that the code may change. That's why you don't have to hold them criminally liable. I don't understand. Can you repeat, please? Dr. Chiu. Well, the code is mainly to do with the license issuance. And it's about quality and safety. The most serious consequence is to take away their license. The director has the power to suspend its service. In clause 34, we have said that if a direction is issued by the director and that is not complied with, it may give rise to public safety. It is an offense. Apart from a fine, it may attract the term of imprisonment. The most effective way is to stop the service. And as to how they are penalized, well, if we initiate prosecution, the effect will not be instant. So there will be 2 levels. If they breach the code, we can give a direction to stop the service. And if that is not complied with, there is a chance that they have committed offenses under the law. So they are not mutually exclusive. You can suspend their, revoke their license, and at the same time impose a criminal sanction. Yes. If they listen to us and improve their service, well, that is, of course, something that we would like to see. That then there won't be any criminal sanction. How much of the code have you drafted that will be for use? Can you give us the paper? Mr. Lee? Thank you. The bill is not enacted yet, but we are making all preparations for the code. The bill will regulate 3 major categories of establishments. For hospitals and clinics, for hospitals, we have drawn reference from the code under Cap 165. It's been revised and improved as well as updated. We have already published the draft. For the one for hospitals, we are drafting it. For clinics, we have published it. We have published the draft. So we can get it from the internet? Yes. For day procedure centers, we have drafted regulatory standards. They are core standards to be applied, core standards to be complied with by all day procedure centers. And there are also standards of the various procedures. Say, for example, for surgeries, there is a set of standards. For endoscopy, a different set of procedure. For all surgeries and anesthesia, we have already drafted the standards and they are uploaded. We have also issued these draft standards to the Secretariat for members' reference. We can also, on top of that, give you these documents again. Can you give us the hyperlink? And it will be forwarded to members. Yes. I just want to read the codes of practice. For private healthcare facilities and hospital authority, the two codes, do they adopt the same standards, or one is more lax than the other? This is about private healthcare facilities. It's the basic standard for healthcare sector. We focus more on day procedure centers because they've never been regulated before. Mr. Fong has mentioned that we have set up a committee with the Academy of Medicine to look into day procedure centers. Apart from doctors, dentists, there are also representatives of nurses and representatives of the HA. So we will take into account, well, there is also representatives of the 2 universities. The standards we published will be the basic standards to be adopted. Let me remind members and others that there is a CB bracket 289417 to 18 bracket 01. Any other questions? Mr. Xiu. Thank you. Well, for the establishment, it will have to be regulated by a doctor. Should there be a breach of the code, will the doctor be held responsible? Any criminal liability? Ms. Wong has been talking a lot about criminal liabilities. Will the doctor be held liable? If there is a failure to comply with the code, there is a chance that the license renewal may be affected. Well, there is also a chance that the license may be suspended or revoked. So the responsibility falls on the licensee. The doctor has the duty to ensure that all operations meet requirements of the Department of Health and the code. So in the medical council, there may be an additional requirement for the doctor to meet an additional requirement.
So the doctor doesn't have the liability. Well, it is an indirect liability. Under this bill, it doesn't have an indirect liability, but the code imposes additional responsibilities, and the doctor has the responsibility there. Mr. Xu, now you go to a doctor, and you go to the doctor because you know him, and the doctor hasn't given any reminder, and the premises are penalized, and the premises have the license revoked. Now, the case that will go to the complaints committee, and what will be the penalty be if it goes to the complaints committee? Well, can you explain a little bit further, Deputy Secretary, please, for the benefit of Mr. Xu? The staff of an organization, if he fails to do something or miss to do something, and the organization will be penalized, then the person will be held responsible. The same can be said about doctors. Doctor has a professional requirement. So under these mechanism, there are dual requirements. The first one is whether the PHF will be able to continue in operation. The second level is the ethical integrity, and these may impinge on his qualification. So with these two levels, it should be of sufficient deterrent effect. If this organization is licensed, and the licensee has to comply with the ordinance, that they can appoint the medical advisory committee or the chief medical executive and run the clinic in accordance with the DH's requirements. If they fail to do so, then the licensee may be in trouble. The staff will be penalized, and if the doctor has the liability, then he should be held liable. So the chief medical executive and the licensee will have the liabilities. Mr. Xu? Well, the licensee is the boss. Of course, he has the responsibility to act in accordance with the code of practice. Now, why to appoint the doctor to look at these cases? Because there are professional aspects, but the licensee himself may not necessarily be a doctor, and you want to include a doctor there to oversee the whole thing. As I said, the licensee may not be a doctor, he's not professional, and there are things that only a doctor would be aware of, and the doctor may fail to remind the licensee. Now, the premises can have the license taken away, and the doctor will be held liable, and the medical council will penalize the doctor. What sort of penalty would that be? Well, the most severe penalty will be a revocation of a license. If there is professional misconduct, that would be struck off. Well, if someone tragically mishandled the case, then that would be striking off. If the doctor fails to remind the licensee about certain things and the license has been taken away, do you think that the doctor would also be liable to be struck off at the medical council? Or there can be a criminal liability, like Dr. Helena Wong always alluded to. Would there be any criminal liability, any custodial sentence that is likely? Under the medical practitioners ordinance, if the medical council is conducting a hearing, then it can consider a whole series of penalties. The most severe one would be disqualification. For other criminal prosecution, it would depend on the merits of the case. It would be hard for us to say specifically about individual cases, but I must emphasize that this is the liability that a doctor would have to face under the registered medical practitioners ordinance. So this bill is not seeking to change that. It's just that under the code of practice, there is another layer of liability on the part of the doctor. Mr. Hsu, we haven't seen the code of practice. The licensee and the doctor will have to fulfill certain standards. Now we are making some guesses. Well, like it was said a moment ago, they have the draft there. What about the day procedure centers? This is being drafted. Mr. Fong? For clinics, they have been posted on the web, and we have given a link to members. Clinics, the day procedure centers, the work is in hand. We have the minimum requirement, the anesthetics and so on. All these are there. Once it is ready, we would make it available to members. Well, we haven't a complete set. Mr. Hsu, now let's talk about the one that is ready. You have posted it on the web. What is the most severe case if a doctor fails to remind the licensee about the code? The licensee may not need to go to jail, but it is likely the license will be taken away. Now, you have the code of practice. If a doctor is hauled before the medical council, what is the most severe penalty? Deputy Secretary? Well, Chairman, all I can say is we don't know about the merits of different cases. Under the medical practitioners ordinance, one of the penalties would be striking off. Mr. Hsu. Well, I seem to be repeating the questions. Mr. Hsu's question is that a doctor, when dealing with the surgical operations, he's governed by the relevant ordinance, but here it is binding the premises. This bill doesn't refer to the liabilities of the doctor, but the premises will be governed by this bill. Your question is governed by the medical practitioners ordinance more, Mr. Hsu. In this bill, you are putting the doctor there. You think that the doctor's role is terribly important. If it is not important, then the licensee can handle everything. Now, since the doctor is there, the doctor's role in the premises would be important. How do you mean? That there is the chief medical executive who has to be a doctor. He can't be a nurse. You put a doctor there because there is a professional perspective. Otherwise, there is no need for this doctor post. Now, the way I understand it, the organization would just be folded. The doctor will play an important role. The chief medical executive would be overseeing the whole thing, and the doctor may be summoned to the medical council to face the penalty. In the most severe case, if the doctor fails to comply with certain things, what will be the penalty for the doctor? Will there be any suspension of the license, or will the doctor be able to get away with it scot-free? That the doctor has the power, and he will face the penalty. Mr. Fong, to get a question. I understand the question, Chairman. I don't think I can answer the question about the penalty under the medical practitioners ordinance. One of the penalties would be disqualification. Whether a breach of the code would lead to that, I'm not sure. Although there is such a possibility, a different case would have different merits. Deputy Secretary, can you tell us more about the Chief Medical Executive? How will he or she be penalized? I think that's the question. The extent of the responsibility. Chairman, under this bill, the Chief Medical Executive is responsible for the day-to-day operation of the PHF and to make sure that it is in compliance with the license conditions. Now, it is likely that the license of the PHF can be taken away. That's the most severe penalty. If the premises are not run properly, they should not be running, and because this would be detrimental to public health. The appointment of a chief medical executive is to ensure the proper operation of the premises, that this is preventative. If there is a breach of the code, despite repeated reminders, they fail to comply, it is likely that the license can be suspended, and the CME may stand to lose its job as well. As I said, if they fail to comply with the code of practice, and if the case becomes a complaint case at the medical council, then the doctor who fails to fulfill to discharge his duty may face his own penalty at the medical council. I don't think I can mention the two in the same breath. Now, we cannot say for sure whether it is the responsibility of the doctor in this context. Dr. Helena Wong. Chairman, I'm looking at the code of practice for the day procedure centers. 3.3 mentions the medical records. I noticed that you're asking them to keep the patient's medical records, but you're not making them join the electronic health record system. There are 11 hospitals that have joined the EHR. There may be new hospitals coming on stream. For the clinics and day procedure centers, isn't it right that under the code of practice they should be made to join the electronic health record sharing system? And because that would foster the two-way sharing of the medical information. I think we are entering into the code of practice. Perhaps you might wish to make a note of this. Why don't you let them answer, Chairman? I'm dealing with clause by clause. Scrutiny is not about the code of practice. But the code is relevant, isn't it? Yes, it is relevant. But we're not dealing with the draft code of practice. Dr. Wong, this is important, Chairman. The reason why we have to regulate the PHFs in terms of the standard and the quality of service. And it is the government's intention to promote the electronic health record sharing. If the bill doesn't say this and the code of practice doesn't mention this either, then does it mean that the PHFs can choose not to be part of the EHRS?
Ms. Wong, is it mandatory or voluntary? Ms. Wong, I need to direct the discussion back to the bill. But it's related. But you're talking about the detail of the code. Then you have to wait. I don't have time to finish it, so I won't last till midnight. You want me to go? It's easy for me to go. You see anyone else here? You don't even allow someone to answer. You're the chairman. You should not speak so much. I will ask you to ask questions. That's what I'm doing. No one else is here. You want me to go? Calm down, please, Ms. Wong. I'm very accommodating. I am extremely calm. Not you, though. You get in the way. Let me remind you. I don't need your reminder. But I am the chairman. Well, I would like you to remind them to answer more quickly. Ms. Wong, we are now on clause by clause. Yes. Let me finish, please. You are talking about specific clause in the code. Say, for example, the electronic health record. We will have time to discuss the entire code. But now we are doing clause by clause. We should not jump to the detail of the code. Otherwise, it will not be systematic. I'll let them answer your question. Then we'll continue. Mr. Fong? Thank you. In relation to the EHR, well, it's done on a voluntary basis. And we would like to keep the flexibility. If the situation changes, we can change the code. At this stage, it is not a mandatory requirement. I asked the administration to seriously consider incorporating it as a statutory requirement under the code, because the government has used a lot of taxpayers' money to put in place this electronic health record sharing system to maximize the benefit of patients. Well, of course, 11 private hospitals participate voluntarily. That's well and good. But why don't you require these clinics to participate? If you leave it on a voluntary basis, of course, they will not be too eager to join, and that is not in line with maximizing protection for patients. You can incorporate it under 3.3 of the code, or the proper section that these centers and clinics should participate in the sharing system. I don't see any reason why they can opt out. Would you please reply to that when you're dealing with the code of practice? Yes, thank you. Next. Thank you. It's now clause 103. It empowers the director to specify in a code of practice a medical procedure that may only be carried out in a hospital, and in that case it cannot be carried out in a day procedure center. Any questions? Legal advisor. If not, next. Thank you. Clause 104 empowers the director to, by notice in writing, give direction to a person or private healthcare facility, give directions as to how the ordinance or the code should be complied with. That is clause 104. Any questions? If not, next. Clause 105 empowers the director to examine by writing any person from any provisions of a code. I'd like to ask, someone may be exempted from complying with the code of practice. You mean those who are exempted don't have to abide by the code? Just like the Chairman said, if they are exempted clinic, then they are not regulated by the code. Clause 105 doesn't really exempt anyone per se. It's just that in the future, if there are provisional license and these people will have to be exempted, then we can use 105. This is just to give us more flexibility. Any questions? No? Next. Clause 106 specifies that if it is specified in this ordinance that a form of document is required, the director may specify the form. Any questions? If not, next. Clause 107 specifies that the director must, for the purpose of this ordinance, establish and maintain a register of all private healthcare facilities that licenses are in force, and a register of all small practice clinics for which exemptions are in force. Any questions? If not, next. Thank you. Clause 108 stipulates that if the certificate of license or a letter of exemption under 43, that is, the original is stolen, lost, destroyed, defaced, or damaged, the director may, on application, issue to the operator of the private healthcare facility a duplicate of the certificate or letter to replace the original. Once it's issued, the original will ceases to have effect. What about the fees? In Schedule 3, we have specified the fee. Let me find it. The duplicate of a license or an exemption is $180. To obtain a copy is item 17, Schedule 3. Any questions? If not, next. Clause 109 stipulates that if a person fails to pay within the time specified by the director for an application the appropriate fee, the director may, by notice in writing, order the person to pay a surcharge not exceeding 5% of the unpaid amount. Any questions? So 365 and 5% of it is a very small amount. Will there be a time limit before the fee and all the surcharge is paid? Otherwise, the application is rejected. If an application is made, fees will have to be paid. It may be an application for a duplicate or a license, and the fee set out in Schedule 3 will have to be paid. Failure to pay the fees may attract a surcharge not exceeding 5%. Failure to pay that, the application may be rejected. that is a feasible way. Any questions? If not, next. Thank you. Clause 110 stipulates that any fees paid under this ordinance is not refundable. Any questions? If not, next. Thank you. This is Part A, Division 2. It runs from 111 to 117. Is set down under the new regime, the power of enforcement. 111 is the interpretation of the term contravention. Any questions? If not, next. Thank you. Clause 112 stipulates that, where it is specified and an investigation is to be made, the director may, by way of notice in writing, require the person to provide or produce information or document that are necessary. Failure to do so, failure to produce the information or document, or the production of such documents are found to be misleading or false, is an offense. So it's $2,000 on the summary offenses ordinance. You're talking about subclause 6 of 112. On summary conviction is a fine at level 4. For a continuing offense is a further fine of $2,000 for each day. Any questions? If not, next. Thank you. Clause 113 empowers the director or an authorized officer to, without a warrant issued by a magistrate, enter a private healthcare facility where a license is in force at any reasonable time and exercise the power specified in Section 116 in relation to the matter set out under 113. This is in relation to a regular inspection. Ms. Chang, I would like to ask, is just for investigation or can they search? Investigation and search. Mr. Lee. Thank you for the question. Well, in clause 116, we will talk about powers upon entry into the premises. It covers searches and investigations. Are there any other ordinances that that gives you the power to enter a premises without a warrant issued by a magistrate? Can I explain? There are 3 provisions, 113, 114, and 115, dealing with different situations. 113 is in relation to entry without a warrant, covering a licensed private healthcare facility. So this is just about regular inspections. They don't need to apply for a warrant to enter a licensed private healthcare facility. 114 and 115 covers 2 different scenarios. I will elaborate when we are there. We will look at those 3 clauses together. You continue with 114 and 115 as well. Clause 114 stipulates that the director or an authorized officer may, with a warrant, enter any premises and exercise the power specified in Section 116 to investigate into whether a contravention is being or has been committed. That means that they need a warrant. And this is not in relation to licensed private healthcare facility. We do think that in such situation it will be more reasonable and proportional to gain entry only with a warrant. 115 specifies that if the director is satisfied that certain conditions are met, then they may enter any premises and exercise the power specified in section 116. This is mainly about 2B, that is, to ensure public health, they need immediate entry into the premises. So this is to protect public health. That immediate entry is required. So 115, you see that it reads power of entry in emergencies. They cater for different scenarios. That is in relation to clauses 113 to 115.
Dr. N. Cheung and then Dr. Helena Wong. Chairman, for the licensed premises, if the director is of the view that there is cause for investigation, then entry can be made. For those that are not licensed, for the premises that are operating without a license, the director will have to obtain a warrant from the magistrate before entry can be made into these unlicensed premises. Is that right? Correct. Mr. Fong? Yes, the interpretation is correct. Dr. Cheung, coming back to my question, do we have other legislation? If you want to enter private premises, as far as I understand, the police would need to have a warrant from the magistrate. The same can be said about the ICAC. If you want to search a clinic, you can enter without a warrant. I mean the licensed clinics, right? Okay. Do we have other legislation that allow entry without a warrant? Now, these are private premises. Do we have legislation that allow these, Mr. Lee? Chairman, thank you. Thank you, Dr. N. Cheung. We have found an example, CAP 572, Fire Safety Building Ordinance. It provides that in order to ascertain whether or not a fire safety compliance or contravention, entry can be made into a premises in a building without any warrant. I understand in the event of a fire, you don't need a warrant. No, it's not catching fire. It's just to ascertain whether the building, the premises are in compliance with the fire safety regulation. I think it's a matter of reasonableness. For the licensed premises, if we want to conduct an inspection, it can be a spot check, it can be a blitz operation. We need to be able to enter these premises without a warrant in order to achieve the enforcement effect. For private premises, under normal circumstances, we do require a warrant, unless in emergency situation, for the sake of public safety, if it is so urgent that we don't even have time for a warrant, then under clause 115, there is a power conferred upon the director. This is for the sake of law enforcement. Is it okay? Dr. Helena Wong. This is only for clarification. For licensed premises, as long as you have reasonable doubts or suspicion, you can enter without a warrant. For the unlicensed ones, if time permits, then you would get a warrant. If time doesn't permit, you would enter in any case. Is that right? In principle, yes. Any further questions? If not, 113, any further questions? 114, 115. If not, let's press on to 116. Chairman, 116 provides that for 113, 115, the power specified for the purposes of section 113, 1141, 1151, and 132, and the powers include to inspect and search premises and to take away samples. Any questions? Dr. Wong. For those who enter the premises to conduct inspection, who are they? Are they DH staff, or would the police be coming along as well? Dr. Chiu? Chairman, thank you. The director can authorize personnel to carry out the task. Any questions? If not, next. Chairman, thank you. Clause 117 provides that anyone who obstructs the director or authorized officer in performing functions, it is an offense. Questions? If not, next, please. Chairman. Division 3 contains 118 to 123. That's about the miscellaneous provisions. 118 provides that the Secretary may require information from licensees. Any contravention is an offense. Any questions? Dr. Wong? Chairman. Now, when the authorized personnel enter the premises, if a patient is undergoing a surgical operation, and if you have suspicion that the operation is exceedingly risky, can you stop the operation and take away all the equipment? Or would you wait until let's say a liposuction, will you await the end of the operation before arrest will be made? Dr. Chiu? Let me say this, Chairman. Under this bill, if there are patients, then it's only with the consent of the patient that the service will be provided. If operation is going on, it will depend on the situation. The public officers or the authorized personnel would exercise their professional judgment as to what is best for the interest of the patient. Dr. Wong, if a patient is undergoing surgical operation, he or she cannot give any consent. You have to wait until the liposuction is over and done with before you can take it any further. Dr. Chiu, if the patient is conscious, then we'll get the consent. Now, if the patient is undergoing operation or what, it will depend on the situation on the ground to see what will be best for the patient. If a surgery is going on, or if a patient is being anesthetized, I cannot say for sure, but it will depend on the professional judgment of the personnel. The patient's safety would be of paramount importance. Dr. Wong, if a doctor or a healthcare worker is performing the operation, would it be good for the operation to be over and done with? And will they be obstructing the officer? In I, it says that the personnel has to offer assistance if they are getting in the way of executing the duty. It may be an offense. So they have to suspend the operation to entertain you unless they be penalized. Well, it will depend on the situation, and we will give advice and instruction. Dr. Wong, this provision is not clear enough. This is an offense, obstructing the authorized officer in performing functions. Now, you are also, in a way, obstructing them. So I'm sure that the patient's interest would be uppermost in your mind. I'm sure that this can become a defense on their part. Mr. Fong, Dr. Chiu has already said that the patient's safety would be of paramount importance. And then they will consider, before they will consider anything else. So there is a priority that will be accorded to the patient's safety would be paramount. Okay? Mr. Wong Ting Kwong, I'll extend the meeting by 15 minutes. Just so that we can finish this part. Well, this situation is somewhat different from other criminal situation. We are talking about the safety of the patient at stake. When you identify this kind of crime, the premises and also the healthcare workers performing the operation are performing the operation illegally, and it is unsafe. And if you enforce the law there and then, it would give rise to additional risk. I don't think you would wait until the operation is over and done with. The operation itself and the healthcare workers there are in breach of the law in any case, and the patient is in danger. And if you enforce the law, you're putting the patient at further risk. Now, how are you going to deal with this? This is a bit of you're in a bit of a bind. So how would you exercise your judgment? What attitude would be adopted by the administration in a scenario like this? Mr. Fong? Indeed, it is likely to happen. There are different inspections. The first one is routine inspection. For licensed premises, this kind of scenario is unlikely to happen. Second, if we do have suspicion of unlicensed operation, it would depend on whether the operation is going on. We have to exercise our judgment as to whether they should stop the operation or we let the operation go on. There is a professional judgment there. Third, emergency inspection. And it is unlikely that we're trying to stop the operation because the patient's life is at stake. So we have to exercise our judgment depending on the circumstances. It would be hard for us to say specifically what's going to be done because different cases would differ. Mr. Wong, I think the administration may tell us more. For instance, you have received some intelligence that something unlawful is going on at premises and you are enforcing the law in the interest of the patient. That's a straightforward scenario. Second, a patient is undergoing an operation. A patient is under the knife, and you are enforcing the law on the premises. And you have to have regard to the safety of the patient, and that would be paramount. It's like someone being kidnapped, someone held hostage by the criminal, and you would have the hostage uppermost in your mind. So it's a question of whether you stop the operation going on, or whether you would allow them to go on for a while until you enforce the law in a safe manner.
The third scenario is when you receive a call to the police and there is surgery is conducted in an unsuitable place by an unqualified person, and it's a matter of life and limb, so you have to treat it as an emergency situation and take immediate action. Is that right? Yes, Mr. Wong has rightly put it. Dr. Pierre CHAN. Thank you. The example of someone taking people hostage is very special. Well, there was a question asked whether the patient's safety is endangered. Well, it's just like, say, for example, when you inspect food establishments. If they fail certain fire services installation requirements, is it the case that all the people who are in the restaurant have to stop eating? From time to time, we have heard cases about someone practicing without a license. They can be easily handled. It's not something special. It's just like the SDU dealing with the situation when someone is taken hostage. But if it is a procedure and if it is halted, and after the investigation no irregularity was found, does it mean that the patient can sue you? Sue your pants off? Under the existing regime, everything can be dealt with. If you put the priority on patient's safety, then of course it can be easily dealt with. But this is about a decision to enter in emergencies. There has been cases of someone practicing without a license, or a doctor practicing when his license is revoked. These cases have been properly dealt with. The administration can explain to us very clearly about what happened in those cases. Yes, the most important thing is patient safety. Under the medical practitioner's registration, well, if someone practices without a license, there are actions to be taken. But this is about an unlicensed premises. So it's not just about someone practicing without a license. It's also whether the establishment is covered by a license. Well, Part 8 will run to 1, 2, 3, and there are still a few clauses to be dealt with. We have 10 minutes. Are we going to continue? Yes. Next one, 119, is the confidentiality to be applied to public officer. A breach of this is an offense. Any questions? If not, next. Clause 120 is the immunity from civil liability of a public officer. Any question? If not, next. Clause 121 is in relation to service of notice. Say, for example, if it is to be served to the director, it can be addressed to the director's principal office. So these are just practical matters. Ms. Chang, I want to go back to 120. It says that a public officer is not civilly liable for an act done or omitted to be done by the public officer in good faith in performing or purportedly performing a function. In Chinese, there is the term Mao A. Why do you have to add this word Mao? In English, you see the word equivalent A. If a public officer is acting in good faith, then that person is not civilly liable. It's just in general referring to any one public officer. Can you give us examples under other ordinances? You're trying to protect government officials, is that right? Can you give us some examples? You're referring to the word Mao A or the entire clause? The entire clause, clause 120. Any examples? Maybe you will look it up and then come back to us. Ms. Choi? In electronic healthcare sharing system, in the ordinance, in that ordinance there is a similar provision. There's also an immunity from civil liability when a public officer is conducting in good faith in performing their duty. You'll find it in Cap 625. So there are two Mao A. A public officer is not civilly liable for an act done. That means that, well, if you are a public officer, you are given immunity from any civil liability. Let's hear from the DFJ. This is a common drafting style in Chinese to express the word A. You start with A, and then the next time you refer to that person, you use the. In clause 90 or 91, it may not be referring to a person, but it's a complaint. We use the word Mao to refer to a complaint of a facility. And it's just so happened that here it says a public officer, an act done, so you'll find two Mao referring to these undefined articles. Well, if members have a suggestion, we will consider it. Well, it's just like when we use the pronoun him or her. Can there be some kind of standardization? It's not really the case that you use her if you're referring to a vice establishment. I think last time Miss Elena Wong was here, and we spent quite a lot of time to talk about this. But when you talk about a person doing a thing, well, you have to be more specific. my name was mentioned, I'd like to say that this is a very common drafting style. I can't tell you whether there is a template. Say if someone has to break the door down to gain entry because a crime is being committed. Say, for example, in a case of suspected possession of drugs, you will have to break the suitcase open. But the person giving the order may be different from the person executing the order. It's the superior that gives the order to break the door down. It's someone else to actually break the door down. I don't recall whether there is an actual template. Dr. Pierre CHAN. I agree with the terms used in both the English and the Chinese version. It's something that I'm interested in. Has there been any actual cases when a public officer is given immunity from civil liability when performing their functions? I agree that there should be clause 120. I just out of interest. I do agree and accept that there should be immunity given to public officer. Ms. Helena Wong? Well, we are concerned about this, although we would like to protect public officer, but it says here that the public officer is given immunity from civil liability, or civil liability, or those that are closely related to the performance of their duties. Say, for example, well, whether it's with or without a warrant, the public officer gains entry into premises where medical or healthcare procedure is being conducted, and someone makes an allegation that the public officer has committed sexual harassment. Does it mean that the doctor or the patient cannot take the public officer to court? So is the public officer given immunity from all civil liability? 120(1) specifies that it is in relation to performing or purportedly performing a function under this ordinance, and it has to be done in good faith. That means it is done in good faith and related to this ordinance. And it's only an immunity from civil liability, not criminal liability. What about an example asked by Dr. Chan? We will look it up and get back to you. May I ask Mr. Fong to clarify? So, say for example, is sexual harassment, then there is no immunity from civil liability. Then one has to decide whether it is in relation to the performance of a function under this ordinance and done in good faith. But let me reiterate that there is no immunity from criminal liability. Say, for example, sexual harassment. Sexual harassment is civil. If it's indecent assault or rape, of course it is criminal. Sexual harassment, is it civil or criminal? It's civil. You can ask the legal advisor. It's under the Sex Discrimination Ordinance. Will you be able to reply in just a sentence or two? Well, it is conducted in good faith in the performance of the function under this ordinance. That is the test. Well, let's stop here. There are 2 dates for next meeting, the 11th of June between 11:15 to 1:45, and the 26th of June 8:30 to 10:30. Is it the case that we will complete everything before we finish? Well, that is our wish. It depends on progress. You know that, well, when I am the chairman, I know I would like to do it as quickly as possible, but I know that the Secretariat is very busy. There is another bill being scrutinized that related to inland revenue and is really thick.
Mr. Wong is very concerned about the Secretariat's workload. Dr. Hon Pierre, very quickly, Chairman, if we have to rush, if we want to get it through within this term, indeed, there is a need to get this done because of the need. Do we need to have additional meetings scheduled? Thank you, Dr. Hon Pierre. We hint on whether the meeting rooms are available. If the rooms are available and if we can slot in the time, then it would be good. There are 2 meetings scheduled for June, not 1. Meeting adjourned. Thank you all very much.